Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation, and welcome to a special post-election episode of The Health Advocates. Today we're coming to you right after the election to give a quick recap on what's going on. It's a special episode, and we're going to keep it short, sweet, and snappy, and I'll be doing it solo today. Well, the polls said the election would be close, and overall, they were right. The election was close. It's hard to be surprised at the results of the election when the polls were so close, but it is surprising to have our only second president to win a non-consecutive term, as well as the oldest elected ever. Donald Trump will be 78 years old when he takes the oath of office in January, and he will have support in Congress too, with the Senate flipping from Democrat to Republican. As we're recording, it's too early to know the final Senate numbers and the final numbers in the House, but if Republicans take the House, Trump will have a lot to work with. So how did Trump win? He built a strong coalition and increased his totals almost universally across the board in urban, suburban, and rural areas. He increased his vote share amongst Latino and Black voters too. It's also the first of his 3 elections that he won an outright majority of the votes, 51% at the latest count as we're recording. So what does this mean for healthcare, health policy, and chronically ill Americans? Trump definitely cobbled together a team with, shall we say, interesting positions when it comes to public health. His most notable ally in the public health sphere is Robert Kennedy Jr., who, if I may say, espouses some dangerous views, to say the least. Trump has indicated that he would appoint Robert F. Kennedy, a noted vaccine skeptic, conspiracy theorist, and former independent presidential candidate, to a key role in his administration in the health sphere. Kennedy has already signaled he would seek to remove fluoride from water, work to remove vaccines in certain instances, though his actual role and plans remain vague. Trump said last week that he would let Kennedy go, quote, wild on health in his administration, but has not stated what role Kennedy would be appointed to. Kennedy's stances on vaccine, fluoride, and other health issues have been slammed by health experts and organizations for having roots in conspiracy theories. He has repeatedly made false claims that vaccines cause autism, and he chaired the Children's Health Defense, an organization that says it wants to end childhood health crises, but is a source of vaccine misinformation. He compared vaccine mandates to the Holocaust in 2022, which he apologized for, and he was previously banned by YouTube and Instagram for spreading misinformation about the COVID-19 vaccine. Just as a reminder, Kennedy does not have any scientific or medical credentials. Prior to his political career, he was an environmental lawyer. Kennedy put together a platform called Make America Healthy Again. So what's in it? Well, first off, it is a catchy slogan, Make America Healthy Again. And there's not a doubt that America could be healthier. We have short lives, avoidable deaths, and less than stellar access to care. However, the first step is to accurately identify what is causing us to be unhealthy and to fix that. And we won't make substantial progress if we chase after falsehoods, of course. But the big MAHA, that's Make America Healthy Again, talking points, organic food, pesticides, alternative medicine, and going after drug companies often lack specificity, are riddled with falsehoods, and widen the risk perception gap, focusing on relatively minor issues while overlooking some significant threats that shape our public health. One of the most dangerous aspects of the campaign is mixing reasonable statements with outright falsehoods. The combination makes it difficult for the general public to distinguish fact from fiction and determine where we can get the most bang for our buck. Some examples from the MAHA platform include Medicaid should pay for 3 organic meals a day for every American. Access to nutritional food is a huge issue in the United States. That part is definitely true. However, there's no strong evidence to date that organic food is nutritionally superior necessarily. Organic food can also be unhealthy. Just because ice cream is organic, for example, doesn't make it a healthy food. And we should definitely prioritize increasing access to nutrient-dense foods, and fruits and vegetables is of course important. But the misdirection in talking about organic versus nutrient-dense or healthy foods could be misleading. A second platform is embracing alternative medicine. Many alternative medicines simply don't work, and more dangerously may discourage people from seeking actual tested therapies. A third is prohibiting members of U.S. Department of Agriculture Advisory Committee from making money from food or drug companies. While avoiding conflicts of interest is very important, this proposal creates a false dichotomy between expertise and industry and excludes valuable knowledge and expertise. A more balanced approach would involve transparent disclosure and management of potential conflict, distinguishing between conflicts of interest that are handled appropriately versus genuine corruption. Public health. Trump's team has called for, quote, cleaning up public health agencies. This sounds a little like trimming the fire department, even though there are more houses catching on fire. While we agree that federal agencies need to be more nimble, flexible, and responsive to the needs on the ground, we cannot overlook the existing challenges in public health infrastructure. Trump has called for the weakening of the CDC through restructuring. The Centers for Disease Control, our national public health entity, holds the state public health ligaments together, if you will, through data and guidance. If the CDC is weakened, the whole system itself starts to break down. Adding more institutions, like proposals to split up the CDC, for example, actually adds to bureaucracy. Institutions need to be cohesive with sufficient, stable, and efficient funding if we want them to be more nimble. So what about Congress? What about laws that might be passed? Well, House Speaker Mike Johnson said just before the election that the Affordable Care Act repeal is on the table should Trump win. We will see what they will do, and right now, we'll see how much fight the Democrats have and in them should the Republicans seek to actually pursue the repeal of the Affordable Care Act. As part of the 2021 stimulus package, Joe Biden and the Democratic Congress adopted expanded subsidies for the Affordable Care Act's marketplaces. If you were an individual, a small business buying private insurance, the tax credits you received to offset premiums were larger. Subsidies were no longer cut off for people making over 400% of the poverty line, and subsidies for people below that were made far more generous. These provisions were later extended through the end of 2025 as part of the Inflation Reduction Act. It's hard to imagine a Republican Congress voting to extend these measures past next year. We'll see what happens, I guess. Trump has promised not to cut Medicare, much as he did in 2016 when he first got elected, but his budgets did envision spending reductions, which were mostly minor and came from cutting provider payments rather than limiting eligibility. The last time Trump had a Republican majority, he tried extensive cuts to Medicaid and also to food stamps, I should add, but ultimately could not get those cuts passed. Trump waffled on how clear he wanted to be in calling for Medicaid cuts during this election cycle, but when he was clear, last time he was president, the proposals had 3 steps. The first was to repeal the Affordable Care Act's Medicaid coverage expansion and replace it with a block grant for states to spend. The second was to place a per capita cap on the rest of Medicaid, meaning states would only be granted a set amount per covered person by the federal government. And the third was to impose a work requirement, specifically to require able-bodied working individuals to find employment, train for work, or volunteer in order to receive Medicaid. Whether Trump can make these plans a reality really depends strongly on what moderate Republicans feel about them. So as for what's in store from a Trump 2 administration, well, we'll wait and see, but of course, we're going to keep a close eye on things here at the Global Healthy Living Foundation and make sure everyone is kept up to date. And as always, we'll make sure to insert the patient voice into any policy decisions that are being made. Well, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts. And hit that subscribe button wherever you listen. It'll help more people like you find us. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.